One question which always touches my heart is I get call, sir, you are ECMO specialist. Now my patient in so and so hospital and on ECMO. Now what is the possibility so the patient will come out of ECMO, or what is the possibility my patient will go home alive? There is no direct answer for this thing. The reason being, those who go to ECMO, they are very, very sick patients. We need to understand. Now, who are those patients who go to ECMO? Maybe suppose 1,000 patients went to ventilator, and out of that, maybe 2 to 3 patients will be fit for, or who cannot recover with ventilator also, they will go to ECMO. That means they are sickest among the patients who are on the ventilator. So the outcome on ECMO will be slightly different. Now, if we see what are the factors which will depend, it depends upon the few factors related to the disease. What is the cause behind the situation, why this patient went to ventilator, and why he didn't recover on the ventilator, now going to ECMO, that is important. Most commonly it is an infection which causes a pneumonia, then goes to ARDS, and they go to ECMO. If this is the situation, across world the statistics says the outcome may be around 55 to 65%. So these numbers again can vary. If a patient is a younger patient, suppose a 25, 30, 40, 45-year patient went to on ECMO, then their outcome is extremely good compared to an older patient who had a prolonged disease, that kind of thing. Now, second other thing, it depends upon the experience of the ECMO center again. A center having a decade or more than decade of experience, those who have treated maybe thousands of ECMO patients with a standard protocol, their outcome will be different compared to the other setups basically. So these are the few factors, but on an average, if we see, the outcome will be around 55. This is in the respiratory segment of the ECMO. Now, in cardiac segment of ECMO, the outcome is completely different. Now, what is cardiac ECMO? People who had suddenly MI or a cardiac arrest and went to ECMO, their outcome is extremely good, and statistics says it can be as high as 85%. In some centers, even it is 90%, depending upon the time to initiate. So there are, now to conclude, there are two kind of ECMO. One is the respiratory ECMO and the cardiac ECMO. In cardiac ECMO, the outcome can be like extremely good. As I told, it will be around 80-85%. In respiratory segment, the outcome is still low, but there are a lot of research going on. The techniques are evolving, and I hope in future the outcome will improve.